everyone, my name is Koel and today I have with me Dr. Henry Galuba, specialist internal medicine, who is currently practicing at the International Modern Hospital, Dubai. One of the illnesses he is managing is diabetes, and since today is World Diabetes Day, we are here to gain some valuable insights from doctor for some commonly asked questions between the correlation between COVID-19 and diabetes. So doctor, first and foremost, I would like to ask you, many people, they have this question. Is there a direct correlation between COVID-19 and diabetes?
Okay, that's a very good question. Okay, COVID-19 is a relatively new virus, and there are many studies which are being done right now. But as of date, according to the American Diabetes Association, there's no direct correlation between having COVID-19 when you are diabetic. However, based on the previous studies and cases that they had, it has been shown that diabetics are at increased risk of having complications when they have COVID-19. Okay, when we speak of complications, this could be pneumonia, acute respiratory disease syndrome, it could be sepsis, it could be acute hepatic and kidney injuries, all these things which are life-threatening.
And many people, they also ask us, like, if they are diabetics, especially, they come up with this question that, is it safe for me to visit the hospital for regular consultation? So what would your recommendation be for these patients who are diabetics and are scared of visiting the hospital for regular consultation?
Okay, that's a very good follow-up question. As I mentioned previously, diabetics are not at a high risk. It means that they have the same risk with the general population. So if you are diabetic, it's very important that you do regular checkups and do a regular doctor's visit. Because when you are in the doctor's clinic, the doctor will assess you. He will get your current sugar and even measure the 3-month sugar, which is called the glycosylated hemoglobin. This can give a clue whether your sugar is controlled or not. Because if not, then there will be some modifications in your medication. Okay. Secondly, if you are diabetic and you think that you are having signs and symptoms of COVID-19 like cough, sore throat, fever, body malaise, headache, loss of taste, diarrhea, and then this is an indication that you should seek consultation right away, because earlier diagnosis means earlier intervention. Okay, and when you do that, you just don't care for yourself, but you also care for your colleagues, your family as well, because when you are positive for COVID, you will be isolated, and when you are isolated, also the healthcare facility can give attention to the signs and symptoms you are having. At the same time, they can monitor your sugar and do some interventions.
Right. And do you think that COVID by any chance can cause diabetes? Because we also get questions from people who are not diabetics, but maybe they are in the borderline and they think that this pandemic, if they somehow contract the COVID-19 virus, they might get diabetics.
Yeah, this is one question which some of my patients ask me, and the answer is no. Until today, there's no evidence that COVID can cause diabetes. However, COVID being an illness can be an added stress to you. So it can raise your blood sugar for a certain period of time, but it will not cause diabetes in any way.
Doctor, the next question I would like to ask you is, what are the other factors that can contribute to make diabetics even sicker during the COVID-19 situation?
Okay, that's a very good question again. And we all know that other diabetics have pre-existing illnesses. Like to mention a few, sometimes they have hypertension, they have asthma, they have liver disease, some of them has kidney disease as well. And even cancer patients are at high risk of having complications when they have diabetes and contracting COVID at the same time. Because the main thing here is that the body is being overwhelmed by all these illnesses. Therefore, complications can start when they have all these things.
Okay. And we have also seen, like diabetics who are falling prey to the COVID-19. More often than not, their regular oral medication is being shifted with the insulin. Why is that so?
Okay, this is one common question being asked some of my patients who are admitted, because in diabetes, you should have a fast management of the blood sugar. Okay, as I mentioned earlier, having an illness is a form of stress. Therefore, it has a tendency to increase the blood sugar as a reaction of the body to stress hormones. Thereby, when they are at the hospital, we do frequent checking of their blood sugar. At the same time, we can give this fast-acting insulin, which keeps their sugar in check. And when you keep the sugar in check, you reduce the inflammation in the body.
Right.
So if there's reduced inflammation, then the healing process will come faster as compared to those not having controlled blood sugar.
Right. Thank you, doctor. Thank you so much for sharing all these valuable inputs. I'm sure we have been successful in answering all the common queries that people have regarding the correlation between COVID-19 and diabetes. And as a final word of caution, do not ignore any signs or symptoms of diabetes or COVID-19. Get yourself checked, come to the hospital, seek the advice of a medical expert if you think it is necessary. Thank you.